A 90-day stop work order issued by the Trump administration sent shockwaves through the global healthcare system, effectively shutting down numerous clinics and withholding vital care from millions. This drastic measure, part of a broader push to dismantle U.S. foreign aid and eliminate programs promoting diversity, equity, and inclusion day, has been widely condemned by international health organizations. These organizations highlight the devastating impact on healthcare access for women and girls worldwide, underscoring the critical role U.S. foreign aid plays in supporting global health initiatives. The U.S. government annually allocates $8.2 billion to foreign humanitarian aid, a seemingly modest 1% of its total spending. However, this relatively small percentage translates into substantial impact, supporting programs that reach tens of millions. The aid is particularly crucial in nations with weak healthcare infrastructures or those holding strategic geopolitical importance, such as Sudan, Uganda, and Ukraine. These programs extend far beyond simple financial assistance. They represent a lifeline for vulnerable populations, often providing access to essential medical services, food security, and educational opportunities. Despite subsequent waivers issued by the State Department claiming that life-saving humanitarian aid remained unaffected, the president's orders created widespread confusion and staffing reductions within aid organizations. This bureaucratic turmoil has resulted in substantial delays, even for essential programs like food assistance. A scathing report from the USAID Inspector General's office revealed that over $489 million in food aid was at risk of spoiling due to delays in distribution, sitting idle in ports and warehouses around the world. The Inspector General responsible for this damning report was abruptly fired the day after its release, a blatant disregard for legal procedure requiring 30 days' notice and a detailed explanation for dismissal. The abrupt pause in foreign aid funding, coupled with numerous other controversial executive orders, has triggered a series of court cases aiming to halt these actions. Legal scholars are increasingly characterizing the situation as a constitutional crisis, citing the president's unilateral dismantling of programs established and funded by Congress a blatant overreach of executive power and a direct violation of the principle of power of the purse vested solely. The consequences of this drastic policy shift are dire and far-reaching. As Dungeorgiou poignantly states, we are really in a fight for our lives for everybody's life. The urgency of the situation demands immediate and concerted action. A legal challenge to declare the foreign aid freeze unconstitutional, the reinstatement of vital USAID personnel, and a robust counter-campaign to combat the administration's misinformation. The lives and well-being of millions hang precariously in the balance, facing sickness and death due to the lack of essential services. The crisis highlights not only the fragility of global healthcare systems, but also the critical importance of sustained international cooperation and the rule of law in safeguarding global well-being. The ramifications extend far beyond immediate health concerns. They raise fundamental questions about international relations, the responsibilities of global superpowers, and the very essence of humanitarian intervention.